We are coming up on the half hour here of Open Lines. I'm going to reset a little bit with our topic. Dr. Allen from Vanderbilt University Medical Center, the Chief of Emergency Radiology, is joining us to talk about all things COVID. We've been spending a lot of time talking about herd immunity and also mask wearing and the different vaccinations. And I do want to get back to the phone lines and encourage everybody, if you have a question, now's the time to call. We have about a half hour to go. 615-737+ is the number. Terry is on the line. Hi, Terry. Go ahead with your question.
Hi, just got a quick one. I guess, how is this vaccine going to affect me later? Is it going to not say, going to actually, make me go 30 or anything like that, but is it going to actually put us in a situation to where I'm going to actually start having respiratory problems later? Or am I going to have a heart attack later? Mm-hmm. I'm feeling like I'm okay now, which I take care of myself. My immune system is up. So, thanks to everything that's possible, I don't have COVID, haven't had it, any of the symptoms. But what is this vaccination going to do to us, later on down the road?
Yeah, great question. Thank you, Terry, for calling in. Dr. Allen, this is such a good question because these vaccines have not been studied over the long term. There just hasn't been that time.
Correct. They have not been studied over the long term in some cases. But what I'll say to you, and that's a great question, and I thank you for that question, because it factors into another reason for vaccine hesitancy or vaccine reluctance, and that is people just don't necessarily trust that there was enough time to actually test these things. Mm-hmm. How did we come up with it so quick? And I'll tell you that although the vaccine was developed very fast, it was developed on the layer of years and years of research. So in terms of mRNA vaccine research that was done, we're talking 20 years of research has been done. And so although to the health and normal public, it seems like these things were just immediately done. Within the research and science community, we've heard about these advances for years upon years, almost like if you think about a prototype car that you saw in the year 1999, and now it finally comes out in 2021, and you say to yourself, oh, wow. So that is what I would make an analogous to. But what I would say to you as well, and I feel like I kind of heard this in his question, is when you get the vaccine, are you getting the actual COVID virus? And the answer to that is no. You are not. You are not getting the actual COVID virus. When you get the vaccine, it is built on the background of mRNA, and it's a DNA blueprint of the virus and protein. So you are not actually being injected with COVID. So the long-term respiratory issues that may be associated with what's termed long COVID, we don't expect that with the vaccine. And what I'll say to you is when we look at the side effects associated with the vaccine, normally the side effects are going to be fever, malaise, you may have some cough, congestion, you may have some myalgias, but those things normally occur within 1 to 2 days from being inoculated with the vaccine, and then they will last up to 7 days, but they will usually be gone by 7 days. You won't have any lasting, lingering effects of the vaccination. Now, when you talk about COVID having the actual virus itself, it's a completely different story. We have something that's termed long COVID, where you can actually have COVID symptoms, in perpetuity. So a little bit different.
All right, let's get to our next caller. Mike is on the line. Mike, thanks for being with us tonight. Go ahead.
Hey, Terry, how you doing?
I'm doing good.
Good evening to the doctor as well.
Good evening.
I would just like to say that a lot of things about this whole pandemic, it's been a lot of political stuff going on here. And being a middle-aged African-American man, I see what's going on. There's two things, and I'll let you guys answer and I'll hang up. But to me, when the first responders and EMTs, nurses, doctors were getting their inoculations, I felt like if blacks and people of color were at a higher rate of contracting COVID, as soon as those first responders and doctors and everything like that were taken care of, why were we next put on that list as a high-risk group? Second of all, It may be touchy, but I don't care. I'm in my 50s. But basically, I feel like if COVID was attacking the majority of the white race in America or overall in the world, it would be a mandate that everybody else that wasn't white can get that vaccine because you were putting them at risk, and that would hold as a higher priority based on what we know about America's history with race. And I truly believe a lot of white people believe that they won't get it, that they're immune from it. But I would, invite you to go on YouTube and see some of the people who are being turned over on their back, on their stomachs, and by 12 or 13 people in a hospital room, and you see that those people are a wide range and diversity of white children, white men, poor, rich, everything in between, diplomas, doctorate degrees, no high school diploma, and everything else is a mixed bag. And I think when people truly see that it's a mixed bag, and when they truly see the suffering that people have gone through, and I've lost my cousin in Detroit from this, and he was only 60, it'll bring home to you how serious this thing can be. And I think that I would like to get the doctor's opinion on why Tennessee is still behind the rest of the state as far as vaccinations and what's going on politically as far as that, because we don't look too good when you compare us to the rest of the other 49 states. And I thank you for the work you're doing over at Vanderbilt. Keep it up. We need more like you. And thank you, Carrie. That's a pretty dress, by the way.
Oh, I
and y'all
appreciate
have a good night.
Mike, thank you. Thank you so very much. Dr. Allen, jump in for me. Where do you want to go first on that?
No, absolutely. So first, I'll touch on a few things. Thank you for your questions and comments, Mike. And I'll try to hit all of them, actually, because I think they are each important. First, the reason that I'm on this show tonight, and I think the reason that you are hearing vaccination push so much is because of the benefits that are related to it. And as you pointed out, Tennessee, we are lagging. We're lagging significantly. Right now, 25% of our state population have received at least 2 doses of the vaccine and are fully inoculated. Unfortunately, that places us in the bottom 10% of states in the country. Only Alabama, Mississippi, and Wyoming are behind us. And so there's a lot of room for improvement there. And so it's going to take people like myself, yourself, Carrie, getting out and really, spreading the word of, listen, these vaccinations will keep our Nashville community safe, right? And when you talk about Nashville community, for me, it means a lot. So I am from here. I'm a Nashville native. I attended Tennessee State University for college. I am an alumnus of Meharry Medical College here in Nashville, and now I currently work as an employee for Vanderbilt University Medical Center. So when you talk about public health in the city of Nashville, it's pretty important to me and near and dear to my heart. So, I would say to you that, we all have to have a combined collective effort. We have seen some improvement. Right now, cases across America are the lowest they've been in 7 months, right? But what we don't want to do is celebrate too soon, right? We don't want to have the Gatorade shower in the third quarter. We have holidays coming up, Labor Day, you've got the July the 4th, and after each holiday, we have seen spikes and surges in the disease. So that would be, something that I definitely think we have to pay close attention to. But one other thing that he did mention, Carrie, that I wanted to make sure that I circle back around to, and it's not an elephant in the room, it's just the person in the room, and that is, as an African-American male under the age of 50, I actually meet 2 categories of the demographic in which vaccine hesitancy is really high: African Americans and people under the age of 50. Now, the reason for those things are different, and I think it's layered. I think you have to speak about accessibility, both in urban and rural communities, for access to the vaccine. And I think we're looking right now to shift more from a mass vaccine setting to more of placing vaccines in clinics, placing vaccines in pharmacy, placing vaccines with local physicians that people trust, the people you see every day regarding your health that you trust. That's, one piece of it. Additionally, when you talk about access, in lower socioeconomic communities, you're dealing with people that may be working 2 jobs, that may be taking care of multiple children, taking care of elderly parents. So when do I have the time to go and get the vaccine? I don't have the time to necessarily break away. So what we have to have, and we're starting to see, is some type of corporate societal responsibility as well, right? We've got companies like Kroger who are giving $100 incentives to individuals if they can prove they were inoculated. Target, they have instituted a program in which they are giving 4 paid hours of time off for individuals to go and get vaccinated. So I think those things are really important, that we see, corporate societal responsibility, within our small communities and local communities, and that will really help as well with the accessibility piece.
Let's get back to the phone lines. Warren is on the line. Hi, Warren.
Hi.
Hi, go ahead.
Yeah, okay, thank you. My question is on herd immunity. There's no way, even if everybody in the United States is vaccinated, that we can reach herd immunity unless the entire world is immunized against COVID-19. Right now, South Africa and India are calling on the World Trade Organization to lift all restrictions on intellectual property concerning patents on the vaccines. This seems an absolutely humane and important thing to do. I was wondering if the doctor supports that move and if he thinks the medical profession supports that move. And I'll take my answer off the air.
Okay.
Thank you.
Thank you, Warren, for calling in. Go ahead, Dr. Allen.
Amazing question, Warren, there. And I like the idea that you are paying attention to a global responsibility in response to this pandemic as well. What I would tell you is that it seems that, I'm not really into politics, but it seems the president has indicated that he would be in support of lifting the intellectual property patents. The thing with that is that as it relates to lifting those patents, I think down the road, it will significantly help. But right now, when you talk about the vaccine itself and development of the vaccine, the problem isn't necessarily the intellectual property. The problem is the raw materials, ingredients, and reagents that we need to make the vaccine are in limited supply. Additionally, countries like Brazil, India, as you mentioned, Sri Lanka, Thailand, they're currently going through immense surges in disease. And as it relates to the things that they need in the short term, I think what we have to look at is more ventilators, getting ventilators to these countries, oxygen supplies are the things that they need. Now, in the long term, lifting the patent certainly will help. But in the short term, I think it's more, of resources, health resources that may be the best option and things that we can provide to our neighboring and adjoining countries.
Such an interesting aspect of this. Okay, I believe that we have Reverend Fuzz on the line. I hope I didn't get this mixed up. Reverend Fuzz, are you with me?
Hi, I'm here. You hear me?
I do. It's so good to hear your voice. Go ahead.
Yeah, okay. Yeah. Well, like your guest, he had 2 quick quips there about the elephant in the room. I've never seen an elephant in a room. I want to have eating that. And the Gatorade in the 3rd quarter. That was cute. Okay, here's my question. I've been a pastor 40 years or longer. I've been close to God 60 years. So I heard some people say God told them not to take the COVID vaccine. And my response to that was, God did not tell you that. And they asked me, how do you know God didn't tell us that? Or how do you know what God told somebody? That's one of the statements is going around. I know that God didn't tell you not to take the COVID vaccine because I know God. And God ain't told anybody not to take that vaccine. And I looked at it and I was wondering, people who you trust. President Obama and Michelle took the vaccine. And I thought that should have been enough trust for African Americans to do it. And it's not. I'm arguing with a doctor who refuses to take the vaccine and I don't know how you get past that. And my other question is, my church, you say herd immunity is 70%, I guess. So if 70% or 80% of the people who attend church have had the vaccine, can we go on and have church without social distancing? That's my question, okay?
Thank you, Reverend Buzz. It's so good to hear your voice tonight, and I hear you were back in the pulpit this past weekend, so we're thinking about you always. Let's take some of those questions. I think the last one is very interesting. Reverend Fuzz is a renowned pastor in our community. If 70% of his congregation is vaccinated, is it okay to be sitting right next to each other in church?
Well, with that, the thing would be this, is that if 70% of the people are vaccinated, there's still 30% that are not. And so the thing will be is that we always have to think about the fact that we're not necessarily just worried about the people that are vaccinated. We're actually more worried about the people that are not vaccinated, because even though I may have been vaccinated, I could still be a carrier. So of the 70% that are vaccinated, they may not display symptoms, and they're actually a little bit more dangerous because they may be asymptomatic carriers because they have, immunity, but they're very dangerous for the 30% who does not. And so I would not recommend that. I would recommend, following social distancing guidelines in church, because in that instance, you would have more than one household in an indoor setting that is, that is a different household. So therefore, we would recommend masks. We would recommend social distancing 6 feet apart if possible.
I'm going to save the other part of the Reverend's question for after we come after breaks. We got to take a quick commercial break, and we'll answer that part next. Stay with us.